As you know, October is Breast Cancer Awareness Month. Breast cancer is the second most common type of cancer known today, despite lots of ongoing research for a cure. 1 in 8 women and 1 in 100 men will develop breast cancer in their lifetime. There are more than 3.5 million survivors in this country, and one of them is here with us this morning.
Teresa Parker is celebrating 2 years as a survivor. She's also a patient advocate and healthcare navigator from RN4U, and today she's going to discuss some helpful tips for newly diagnosed breast cancer patients. Hello, Teresa, and welcome to the show. How you doing?
Thank you for having me. I'm doing great today.
Of course, we're glad you're here. First off, talk a little bit about your journey and what you've learned.
I was diagnosed 2 years ago in March, and it was very frightening. I'm a nurse, and still as a nurse, it was very, very frightening. I had no symptoms, went in for a routine mammogram and was called back. And the waiting was the worst part for me. I had a biopsy, and it showed some irregular cells, so then I was referred to an oncologist, had another biopsy, and again showed some irregular cells, and then had a lumpectomy which showed the cancer. So that led to a mastectomy. I am cancer-free today, but along the journey there were lots of questions and just lots of uneasiness, I should say.
And Teresa, you want people to be aware of some of the things that you go through in cancer. It's a roller coaster ride, and you say that you don't have to be strong all the time.
That's exactly right. You know, women think they have to be strong all the time, I think, anyway, right, Colleen?
Yes.
We think we're superheroes. And you don't have to be strong. I think women should know that you can experience many, many different emotions. I remember being very fearful, very anxious, depressed, crying, and at times I needed some help with that. I needed some medication. And a lot of women, they don't think that that's okay, but it's perfectly okay. I was lucky that I had a great doctor, and he told me, you know, you don't have to do this alone.
That's right, and it's such a brave thing to ask for help, to say, hey, I'm struggling here, I'm having a hard time with this, and to reach out. You also want people to know, Teresa, it's okay to get a second opinion.
Yes, yes, absolutely. I had a great surgical oncologist, one of the best in Charlotte, but I felt like I needed a second opinion. I needed to know that the treatment he was suggesting was the right treatment for me. So I even had a second and a third opinion. And if your doctor is not okay with you getting a second opinion, you might think that that physician is not the right physician for you.
You also advise patients to stay away from the internet when it comes to breast cancer information. Why is that so important?
Well, today we Google everything. You know, going to Google, that's the easiest thing to do. But there's a lot of information out there on breast cancer and everything else that's really not good information. I would suggest that you get your information on breast cancer from your medical provider, or Komen, or the Pink House, Carolina Breast Friends. They have lots of literature they can provide to you.
And Teresa, very quickly, some advice for patients who are going to be having a lot of doctor's appointments. You say make a list of all the questions you may have ahead of time for your doctor.
Absolutely. When you go to your doctor's appointment, it's very overwhelming. The doctor's going to be throwing lots of information to you very quickly, so it's very helpful to write down your questions, take that list of questions with you with a pen and a pad, and write down the answers as they go along.
It's also a great idea to bring someone along with you to an appointment, and RN4U is a great resource for that, for sure, if you've been recently diagnosed. For more, check out rn4u.com, rn4u.com. But what a valuable service to have somebody who can be there and help you ask the questions in case you forget, or if emotions get in the way. That's what Teresa and her team do at RN4U. Thank you so much for being here.
Thank you very much.